Hello and welcome to our channel. In today's video, we will share with you 6 signs your cat might have diabetes. Before we start, don't forget to subscribe and like for more videos like this in the future. And after watching this video, if you think it is useful, please share with others. So let's begin. Cats can suffer from diabetes just like humans do. And in fact, it's a lot more common than you might think. In this video, we will go over 6 signs that your cat may be suffering from this disease, so you can keep an eye out for them and get help from your vet when needed. The first sign is increased thirst and urination. One of the most common signs of diabetes in cats is increased thirst and urination. Cats with diabetes have high blood sugar levels, which can cause them to feel thirsty more often. This leads to increased water consumption because of the excessive water intake. Their kidneys try to filter and eliminate the excess sugar in the blood, resulting in increased urine production. If you notice that your once well-trained cat is now having accidents around the house or is using the litter box more frequently than usual, it could be a sign of diabetes. Additionally, if you notice that your cat is always by their water bowl or is drinking much more water than usual, it is also a possible indicator. It's important to note that increased thirst and urination can be caused by other conditions as well. So if you notice these symptoms in your cat, it is best to consult with your veterinarian and have them run some tests to determine the underlying cause. The second sign is weight loss. Another sign of diabetes in cats is weight loss despite an increase in appetite. When a cat has diabetes, their body cannot properly use the energy from food because insulin, which regulates blood sugar levels, is either not being produced enough or is not working effectively. As a result, the cat's body starts to break down muscle and fat for energy instead, leading to weight loss. However, it is important to note that weight loss can be a symptom of various other health issues in cats, such as hyperthyroidism, cancer, and parasites. Therefore, if you notice your cat losing weight without any changes to their diet or activity level, it is crucial to schedule a visit with your vet for a proper diagnosis and treatment plan. If your cat is diagnosed with diabetes, your vet may recommend dietary changes and insulin therapy to help regulate their blood sugar levels and prevent further complications. The third sign is increased hunger. When a cat has diabetes, their body struggles to absorb glucose from their bloodstream, even if they have just eaten. This happens because insulin, the hormone responsible for regulating blood sugar levels, is not being produced correctly or is not functioning properly. As a result, the glucose stays in the bloodstream rather than being used for energy, leading to increased hunger. Cats suffering from diabetes often have an insatiable appetite and eat much more than usual. But they still lose weight because their bodies cannot properly digest and absorb nutrients from the food. If you notice that your cat is constantly hungry and eating more, but is still losing weight, it could be a sign of diabetes. Other possible causes of increased hunger include hyperthyroidism, a condition where the thyroid gland produces too much thyroid hormone, and dental disease. If left untreated, diabetes in cats can lead to serious complications such as ketoacidosis and even death. The fourth sign is lethargy. Lethargy is another sign of diabetes in cats. When there is too much glucose in the bloodstream, the body tries to get rid of it through urination, which can lead to dehydration. Dehydration can make cats feel weak and lethargic. Additionally, diabetes can cause cats to lose appetite and skip meals, which can contribute to feelings of tiredness and lack of energy. If you notice that your usually active and playful cat is suddenly lethargic and doesn't seem interested in their surroundings, it could be a sign of diabetes. It is important to note that lethargy can also be caused by other factors such as pain, stress, and certain medications. Therefore, if you notice any signs of lethargy in your cat, it is essential to consult with your vet and rule out any underlying medical conditions. Early detection and treatment of diabetes can help improve your cat's quality of life and prevent any potential complications. The fifth sign is poor grooming. If your cat is diabetic, they may struggle to groom themselves effectively, which can lead to matted fur and a greasy, oily appearance. The high blood sugar levels associated with diabetes can make it difficult for cats to maintain their usual grooming habits. Additionally, the frequent urination and increased thirst caused by diabetes can lead to a lack of time and energy for grooming. Cats suffering from diabetes may also experience a loss of appetite and weight loss, which can further affect their ability to groom themselves. Poor grooming in cats can also be caused by other factors such as arthritis, cognitive decline, and stress. However, If you notice that your previously well-groomed cat is struggling to groom themselves, it could be a sign of diabetes. Regular brushing and bathing may be necessary to help keep your cat clean and comfortable. If you notice any concerning signs during grooming, such as excessive shedding, skin lesions, or a lack of mobility, it is important to consult with your vet and rule out any underlying medical conditions. The sixth sign is cloudy or frequent eye discharge. A buildup of glucose in the eyes can cause a cloudy discharge that looks like a film or a white film on the eyelids. High levels of glucose in the blood can lead to a variety of complications, including damage to the blood vessels in the eyes. This damage can cause fluid to leak into the eye, leading to a cloudy or hazy appearance. Additionally, diabetic cats are also prone to developing cataracts, which can cause cloudiness in the eye. Frequent eye discharge is another sign of diabetes in cats. When the body struggles to process sugar due to a lack of insulin or ineffective insulin use, toxins can build up in the bloodstream. These toxins can irritate the eyes, causing them to water and become inflamed. Cats suffering from diabetes may also develop a condition called diabetic retinopathy, which causes the blood vessels in the retina to become damaged and leaky. This can lead to fluid buildup in the eye, causing a cloudy or hazy appearance. If you notice that your cat's eyes are cloudy or have a frequent discharge, it is important to consult with your vet as soon as possible. Early detection and treatment of diabetes can help prevent further complications and preserve your cat's vision. It is important to note that these signs may also be caused by other conditions. So it is important to take your cat to the vet for a proper diagnosis and treatment plan. The sooner diabetes is diagnosed and treated, the better the prognosis for your cat. With proper management, many diabetic cats can live long, happy lives. Please share this video with your friends. We would really appreciate it. Thank you for watching.